Okay, great. Let's get started. Candace, do you want to go ahead and introduce Ashley?
You're muted, dear.
I was having a whole conversation by myself. I'm sorry. I just wanted to thank you guys for coming on Zoom today for our monthly CHW meeting, and for Ashley and Leticia for agreeing to speak for us today. So first up, we have Ashley, who I'm going to read some of her, but she has over 14 years experience in community and public health. And for the last 5 years, her focus has been on promoting health equity, improving social determinants of health, innovative program applications for community health workers in and out of the healthcare setting, as well as promoting and driving underserved community health focused projects across the state of Texas. She is a founding member and serves as the president of the board of directors for the Texas Association of Promotores and CHWs. She serves as the APHA CHW section chair, serving the workforce nationally. Ashley's passion is to build partnerships that support, promote, and elevate CHWs, as well as teach continuing education to CHWs across Texas and nationally. Ashley, in her presentation, will discuss the history of APHA CHW section, ways to get involved, and share upcoming events and activities. So we are going to, as they say in Congress, yield the floor to Ashley. Thank you so much.
Thank you, Candace. I'm assuming, yes, I'm unmuted. Great. And can you all see my slide and not the presenter view? That's good too. Okay, good. I just like to check. Sometimes when I share, it's funky. All right, cool. So yeah, hi everyone. I'm Ashley. I am a community health worker. I'm experientially certified in Texas. We're fortunate enough to have formal certification. I know not every state does. But while you're getting to know me, feel free in the chat to plug in who you are, tell me where you live, your organization, and if you just want to have fun for a quick minute, I'll try to take a look in the participant. But if you want to do a thumbs up for if you're an ally, and a heart for a CHW, just because that way I'll kind of know who our audience is. I'm assuming it's predominantly CHWs, but I'd just like to check every now and then. Allies like to get involved too. I see that Anelli is CHW. I guess everyone else is still kind of getting focused on dropping stuff in the chat. Just trying to get y'all activated so it's not death by PowerPoint. I definitely like to hear from folks. Yes, thank you, Maureen and Candace, for participating. Y'all are in Chicago. I love Chicago, by the way. It's one of my favorite cities. One of my closest friends went to college there, so it's a fun town for sure. Awesome. Well, so nice to meet everyone virtually. I've tried not to, again, bore everyone to death. I'll just tell you a little bit about APHA briefly. I think that, oftentimes people kind of know, but don't really know what APHA is about. And so I always like to just share a little bit of information. Yes, they are a not-for-profit membership-based organization, but they also have very strategic missions around public health. And so, or their mission broadly is to improve public health and achieve health equity. And their vision is to create the healthiest nation in one generation. I'm sure that a lot of you have probably seen that information before, if you're familiar at all, but if not, I think it's always good to touch on. And then the values of the organization is to reflect the beliefs of the members and disciplines from public health from over 40 countries across the world. So even though they are the American Public Health Association, they do support global efforts. And then some of you may be familiar with some of these initiatives like the Generation Public Health. It's really cool. I definitely encourage you to, just do a quick Google like APHA Generation Public Health. You can find out more about how to get involved in those efforts. And also their Speak for Health campaign. So if you don't currently follow us on social media, we did just do a whole slew for the Speak for Health campaign that typically starts in August when Congress is taking a break, and it encourages folks just to reach out and definitely support those public health priorities that you are passionate about, and letting them know, what you support, what you don't, those kind of things, giving them feedback. And then they have this really cool, I'm proud to be a public health worker campaign that was released earlier this year, just for like a quick snapshot. They have so much more than that, I can assure you. And then just a little bit about their strategic plan. So not only do they have that mission, but they're also focused on these 3 core areas: strengthening public health practice, building a public health movement, and aligning the organizational capacity and infrastructure. And this is really for folks that are involved in APHA leadership. Again, I'm not employed by them. I am just a current section chair, and I'll explain more about what that means here shortly. I just like to share this information broadly because so many people are not really familiar with what APHA does or what they're about. And then just briefly too, just kind of sharing with you their membership structure. So they have over 53 state and regional affiliates. And I'll talk a little bit more about that later. And then they have sections, which I'm also going to explain. And then they have SPIGs, and then they have forums. They also have a student assembly, and they have caucuses. So it's really robust, right? Like, I know this is a lot of information. There are people that have been involved in APHA leadership that are still learning this. So there's a lot of governance behind it, but it's all intentional and purposeful to, again, achieve that mission and focus on those three key priority areas. But when we talk about the CHW section, I always like to share kind of our journey. So the section itself was really birthed in the 1970s. There were approximately 500 community health workers and various supporters and allies that really joined together at that time to form a new professionals special primary interest group, which is also known as a SPIG in APHA language. And then in the 80s, we start to see like membership and activity around this big kind of decline, but it still continued. And we held a business meeting for the first time at the annual meeting and really started to take shape of not only the workforce of what you know it today and the definition that you use, but really the section overall to support this workforce. And then in the 90s, the SPIG itself was revitalized, and we really started to find our voice within APHA. We found those allies. We're working with the executive director or the leadership to really make sure that everyone understands who and what we are. So this journey has been, 30 plus years in the making, 40. Oh, aging myself. Okay, so and then we get into the 2000s. This SPIG finally officially changed its name to Community Health Workers. And we had our first unaffiliated governing counselors. And actually, Dr. Lee Rosenthal, who many of you may be familiar with, she's been around for a really long time, is still involved in leadership to this day, which is super cool. But this is also where we submitted a resolution in support of community health workers, which is the policy statement that's commonly referred to. I mean, if you look at any type of article around community health workers, this particular statement is referred to, and this is really where we get that definition of community health workers. And this policy statement was formally adopted in 2002, which was a super huge win for the section. And then in 2009, the CHW SPIG became the actual section that you know about today, or about to learn about if you don't know. I just wanted to share you kind of our journey. And it's important to note too that throughout the course of all of this, there was definitely a fight, an uphill battle. There was a lot of advocacy behind the scenes to get this workforce recognition and understanding about who and what we are. And I'll also just tack on briefly, a lot of the efforts that we now see that's great, like ILCHWA and the Unity Conference, a lot of that stuff has been led by former APHA CHW section leadership nationally. So those folks that were elected for the first board, that were that interim board, like Wendy Hernandez and others that you may be familiar with, were a part of this work because of the APHA CHW section. And not everybody always knows that. And then not that I want to read this to you, this is a nice little fun picture, and you'll see my little bestie there, Leticia, who you're going to hear from here shortly, when she was our current section chair. We just were having fun at this annual meeting. But broadly, the section does advocate and promote the voice of community health workers within public health, the community, and healthcare settings. We also like to contribute to the roles. So we know that, depending on where you're at, you may be a promotora de salud, you could be a community health representative, an advisor, and other related titles around navigation, et cetera. But we really do this through a focus on policy, development, and other opportunities, as well as provide a forum to share those resources and strategies nationally. So if you have something going on in your state or your area that you want to share out broadly, the CHW section at any given time has approximately 800 to 900 members. And again, some are global. So it's predominantly in the US, but there are several other members across the globe. And it really does provide, the lens of the CHW section really does provide that sharing of ideas, lessons learned, best practices, and also just, promoting what you have going on. So I'm not going to read all of this to you, but I am going to provide a copy to Maureen if she's going to do a share out after this event with, the other announcements that she shared in the beginning before the recording. But broadly, we are focused on leadership development, our membership engagement, of course, on behalf of APHA, CHW recognition, which I'll talk about a little bit later, and then policy development, which I'm also going to touch on in more depth. And so if you are looking for a leadership opportunity, I can't stress this enough. There is so much opportunity within this HW section. We're always looking for leaders, both appointed and elected. And so feel free to reach out. I'm definitely going to drop my contact information in the chat here shortly. And then in addition to a copy of the slides that you could refer to later, I'll also include the APHA CHW section kind of brochure that has the contact information for a lot of the people I'm going to be touching on and what their roles are, et cetera. So as I mentioned before, Leticia, who you're going to hear from in a little bit, is our former immediate past chair. So she ran the section for a little bit longer than she should have, but she's a longtime leader and can answer any general questions as well. So when she shares her contact information, feel free to reach out to her too. Again, she taught me everything I know. I got to shadow under her and learn under her for a couple of years. And then our upcoming chair, so I will be replaced in November. That's just the run of the game. So I've been leading the section for 2 years, but our chair-elect, Floribella, she's in Arizona and she'll be taking in on this role in November. And then when I'm talking about my other leaders, I couldn't do anything without these two right-hand women that are featured here. So Keela is my current CHW section secretary. So she just helps with the minutes, of course, of the meetings and any other kind of like ad hoc duties too. She's truly exceptional. I really appreciate her. I was so glad that she was elected because I didn't really know her before then. But she just, took an opportunity to get involved in this section. She's a really great advocate and leader in this space. And then Kim Bush, I'm fortunate enough to know from many other hats within Texas where I live and am housed. But she's my current treasurer, and I couldn't do a lot of that work without her. But I'm just giving you kind of definitions of what these roles are because these are elected positions. And so if you join the APHA CHW section and there is a call out for elected positions, you can always refer back to this and learn more about the roles. We are going to have upcoming elections after November. So definitely if you join, stay tuned and pay attention to those announcements. But if you're just curious, this is just for an FYI. And then looking at our committees. So we have a ton of committees. I'm not going to spend a whole lot of time on each and every single one of them, but the ones that have things going on that you might want to be a part of, I'm definitely going to touch on. So education and capacitación is a really key and integral committee that we have within the section. And I can't stress this enough either. Just as a sidebar, before I get into who and what they are and what they do, you can join any of our committees without being a member of APHA. It's a nice little gray area / loophole to get you involved and learn more about what it is to find the value in becoming a fully fledged paid member. So if you're interested, again, the brochure that I'll provide to Maureen that she can share it with you all after, and I may even try to upload it into the chat if I'm able to here shortly, will give you the contact information for these two committee chairs. And so Angela Ellison is also based in Chicago. She has been the leader for a very long time there, and we just recently onboarded Mario. But together, they really support this committee, and everything they do is around the development and education and training standards for community health workers, predominantly in the United States, but also they have supported efforts globally. So they do have 2 upcoming events. Definitely follow our Facebook page for more information. Again, the information on that will be in that brochure I'm going to upload here shortly. I don't know why I missed the QR code in this presentation, but I digress. But we have 2 coming up. So one of their sessions will be on the scope of practice. I think it's just meant to be an open conversation with community health workers. They're going to share some, best practices, things that different states do, but then they're going to turn it over to the participants to learn more. And then in December, they'll have one focused on mental health and what CHWs are doing around mental health disparities across the country. And this is just kind of like a little snapshot of some of the promotions that we've had in our perspective series. So we have done some in the past around sustainable payment models, around telehealth efforts, and more recently, last week, they had a conversation around COVID-19 resilience. And so that was just an open conversation with the participants. I think there were about 30 attendees. So definitely, again, look for these invitations and registration on our Facebook page if you're not currently a member. If you are a member, you'll get notice about when that goes out. But definitely, if you're interested in training and education and capacitación, you'll want to reach out to these 2 to get added to their, I think they meet bi-monthly. And then looking at policy. So if you're interested in learning more about what CHW policy looks like nationally, getting involved, currently our policy co-chairs that are featured here on the screen are working on a policy proposal titled A Strategy to Address Racism and Violence as Public Health Priorities, Community Health Workers Advancing Racial Equity and Violence Prevention. Romana Rabbani has been active in our policy section for many, many years. Great advocate, great ally, has a lot of great information and keeps a pulse on what's happening policy-wise nationally. And then Angie Kuzma, also been involved in this space for a very long time. She was formerly with ILCHWA in Oregon. She is now the policy person for NACHWA. And so she's definitely taking a look at everything that's happening nationally there too. And then Abdullah is one of our newest co-chairs, and he is involved directly in racism and racial equity and violence preventions, like boots on the ground. Huge and strong and passionate advocate, and has a lot of information. I think his project is funded by the CDC, but don't quote me on that. But these are fantastic folks to reach out to. They do policy meetings, I want to say also bi-monthly, but you would definitely reach out to Romana if you want to get involved. And again, you do not have to be a current paid APHA member to be involved in the committee. So it's a great way to get started. And actually, I think I had a pop-up for that. There you go, my lovely little guy. Okay, so our next committee that I always like to touch on is program planning. We actually have full leadership now. For a while, we really wanted to secure some additional program planners, but we've been able to fill those spaces now. So Paige Manking has been in this space for, I think, 7 or 8 years. And the program planners really are, if you will, in charge of the annual meeting components for the section. So everything she does is coordinating those scientific sections, but also securing reviewers for the abstracts, to score them and see what will be accepted for the annual program. She helps to plan our business meeting, aids in, our social events, which I'll talk about here shortly, and secures volunteers for our public health expo booth. And actually, this picture here, I know you can't tell because we've got masks on, but that is me. And that was at the annual meeting last year in Denver. And this is on the APHA membership webpage. I just found it this morning. It was cracking me up. I didn't even remember them taking that picture. Anyhow, this is an example. So at the expo, if you've never been, they have a huge setup with, vendors and different kind of public health partners and organizations that set up, of course, and, have their demonstrations. They're trying to sell things, but they also have booths for each of the sections, SPIGs, caucuses, and forums that are under APHA. So you can learn more about what they do, how they do it, when they meet, how you can get involved. It's a super great opportunity if you're not already involved, but you end up attending this and you're not really sure where to join or what you want to learn. This is one of those examples. We just have volunteers from the section come and volunteer for like an hour of their time, where they speak to what the section does and how to get involved in any open leadership opportunities that we have. So it's a great way to learn more too. And then next, I'm going to touch on our governing counselors, but not too long. But Majeline Begay has been a long time leader in this space as well. She's been with the section for well over a decade. And then Maria Herrera is one of our newest governing counselors. But predominantly what they do is a lot around the voting. So if you didn't know, APHA does a ton of elections for elected leaders, both at the national level, directly under the greater APHA organization, and then at the sections, the SPIGs, the caucuses, the forums, all those things, they all have elected positions as well. And so predominantly what they do is help with a lot of those rosters. They also help to vote on behalf of the section for public health priorities, for policies that get pushed through nationally. It's a super huge and important role. We're so pleased to have them on leadership. But you can read more about it of your own accord. I really don't want to spend too much time on that. But again, this is an elected position. I believe that their terms are set for 2 years. And then section counselors. The difference here is they really just help to make general recommendations to the section on various things, from annual meeting programs to section policies to joint policies to working with other sections and SPIGs. And they really do assist me in the chair preparing for annual meeting. And so you'll see that you've got a couple of familiar faces here, Kim, who's our current treasurer, Angie, who's our policy co-chair. They're also elected section counselors. And then Julie St. John is someone that's been around for many, many years as well. She's literally written the book on CHW. So many of you are probably pretty familiar with Dr. St. John, but she's also one of our section counselors and kind of a key informant. And these are also elected positions. I believe their term is also 2 years. And then we have special advisors. So I talked about Dr. Lee Rosenthal earlier. Again, she's been involved in the section since at least the 90s, if not earlier. And so she and Maria really help to advise in key areas. And I'm not going to get into too much of that, but I just like to highlight them because we do rely on them for a lot of great information in the historical perspective and also with a cultural lens. And And then all of these positions are also elected. So Katie Sakawi has also been involved in not only APHA leadership for a very long time, but the Unity Conference. If any of you were fortunate enough to attend the one in Dallas, which is the only one I've ever attended in person, Katie really ran that entire show. So she's been involved in not only APHA leadership for a long time, but also Unity. And then Darrell Fox, many of you are probably very familiar with too. He's been in the game for a minute and he presents all the time, and he's been involved in section leadership for many, many, many years. But these are all of our different liaisons. Again, I'm not going to spend a lot of time here because I definitely want to open it up for questions and I don't want to take up too much time and just really want to focus on the meat of things. But definitely reach out to any of them if you have questions about their roles or what they do when I share that brochure with you post-event. And then last but not least, in terms of section stuff. So I can't stress this enough. If you've never attended the annual meeting, if your organization has the budget for it, please, please, please join us and register now. It will be in Boston. It is the 150th anniversary for APHA. It actually started in Boston 150 years ago, which is super exciting. But there's so many great events. And so this is a few snapshots of us meeting and doing like informal meetups outside of Denver. Just because of COVID and things, there wasn't a lot of meeting space internally, but this year everything, I think like 90% of it is in person. So it's going to be a super exciting event. There's going to be so many sessions, so many opportunities for network. The specific CHW section events that I want to share with you is we are doing a pre-conference event. It'll actually be 2 days and it will be on racial equity and violence prevention. And it is led by our policy co-chairs. And that will be on November 4th and Saturday, November 5th. This is actually separate from the annual meeting in that it's its own event. The Eventbrite information will be shared out shortly. So I'll make sure that Maureen gets that as well so she can share it out. I think they're looking to release it like next week, so stay tuned. But again, it's completely separate. So if you can't make it to the annual meeting, but you are able to travel to Boston for this, I highly encourage it. It's another great way to get involved, learn, and meet other folks in section leadership. And then our social, which is just an open networking, informal evening where we usually have, you know, some booze and some snacks, and we do our awards ceremony then, is being held on Monday, November 7th. You do have to be registered for the annual meeting because it will be on conference space and you'll have to have your badge and the whole 9 yards. And same with our open business meeting. So that'll be held on Tuesday, November 8th. And this is another way. So let's say for argument's sake, you are a member of APHA, but you're a part of other sections, but you want to learn about the CHW section, or your colleagues do, or other allies that you know are attending want to learn more. They can just come and learn more about what the section does, how we do it, our priorities. This is also where we get feedback from section members on what our work plan should be in the coming year. So Floribella will probably be leading that part. But just giving you, you know, these opportunities, in addition to all of the sessions. There are so many sessions. I don't think that we have a draft agenda yet, but as soon as we do, I'll also make sure to share that with Maureen so she can get it out to you all in case you're interested. And then I also briefly like to touch on what we do in terms of involvement. So as I said before, many of us have been involved in the formation of and or a part of various leadership components in NACHWA. I'll also say that several of APHA CHW section leaders have served as board members, you know, other ad hoc advisors. I think that Darrell is like on their policy committee and or has been a board member. Paige has been a board member. As I stated before, several key leaders from our section have helped to establish that organization to what it is today. And then if you're familiar with C3, a lot of you probably rely on their competencies. Dr. Leila Rosenthal has led that, and Dr. Julie St. John has also been a part of it, as well as Paige. And then Evelyn Floribella from Arizona that's taking over as section chair has also been a part of those efforts. And then if you're familiar with Project ECHO, various folks in leadership have either worked or supported those efforts. Again, as explained in the introduction, I'm the current president and one of the founding board members of the Texas Association of Promotores and Community Health Workers. And then my beautiful counterpart, Leticia, that you're going to hear for shortly. She's the leader and I believe also established the Illinois Community Health Workers Association. So we've always had ties there. And then the National Community Health Worker Training Center, which is out of Texas A&M, has also been actively involved in sections in the section in the past. And last but not least, if you're not familiar with the Community-Based Workforce Alliance, this was really formed during COVID-19 as a way to make sure that the workforce was not being taken advantage of or was being let's say tapped into appropriately. So this particular guide book that was put together, it was led by Denise Octavia Smith from NACHWA, but also several of us like myself in APHA leadership and other organizations, including Families USA, Health Mile, what is it called? Last Mile Health, and Families USA and many others came together to put together this document on, harmful and helpful practices to incorporate CHWs in their COVID-19 response. But that work is still continuing, and there's other support mechanisms that are taking place through that organization. But that is my now 21 minutes. I tried not to go over, but here we are. So I think that I'm going to stop there, and I'll just see if anyone has any questions that I could take quickly before we turn it over to Leticia.
Before I get started, so the Illinois CHW Association, we've been around for some decades. We were first the Chicago Community Health Workers Local Network, and I see Venuncia on the call, who has been a long time CHW and advocate, and was a part of that work with the Chicago CHW Local Network. So and that's where Wandy came in at, right? She was working with Promotores in the Pilsen, Chicago West Side area. They all got together to support each other. And really, it just started to grow and grow. And then Wandy was able to get a financial backer through Health Connect One, and we were housed at Health Connect One. I later joined as the board chair of the CHW local network. And this is dating back to at least 2007. I think that's when we got fiscal leadership under Health Connect One. And now with our 501c3, we are incorporated and now operate under the name of the Illinois CHW Association. Membership organization for community health workers, allies, and supporters. We have a membership of over 400 community health workers, allies, and organizations. And really our mission is to unify the voice for community health workers in the state of Illinois and beyond, right? Because as Ashley mentioned earlier, I have ties with the APHA, and I have to just backtrack a little bit. Before NACHWA was here, we had APHA CHW section. Like, that was a space for all of us to get together and just really learn lessons from other states around what CHWs are doing, how to advance the workforce. So then NACHWA was developed, but I would have to say NACHWA is singularly focused on the workforce, while APHA has a broader spectrum. So it definitely is beneficial to be a part of CHW section, because if you have other interests in HIV and AIDS or other parts of the public health workforce, then you're able to connect right then and there. NACHWA is just a strong advocate membership organization that accepts, allies and supporters, but is solely focused on the CHW workforce in all aspects of it. So we're just a state version of a NACHWA, right? And some of our successes, which I think I get into on this slide, but you all already know who CHWs are, but in case you weren't clear of the many hats that you wear and others wear under this workforce, I always love this slide here. And again, Ashley is so right that we have included this definition in 2 of our state laws here in Illinois. And we're really trying to push everyone across the country and the nation to adopt this definition so we can all be on the same page. And you all already know that. So here, I just wanted to give a little bit of background, right? So if you didn't know, CHW work dates back all the way to the 1920s. At least that's where my presentation starts. And the concept was definitely born out of the barefoot doctors. Anybody old enough to remember that? I didn't think so. But in the 1960s to the 2000s, CHW models emerged in different countries. So don't let anybody tell you that this is a new workforce. It's just really getting the recognition across the country, as it should have a long time ago, right? So it's not a new workforce. We've been doing this work, and this work has been done over decades. In 2003, the Institute of Medicine recommended that CHWs be members of healthcare teams. In 2009, APHA adopted that standard definition, and we received a standard occupational code. Now that's important when it comes to billing. In 2010, the Department of Labor recognized CHWs, and under our famous, well, at least for me, the most famous President Obama, we had the Affordable Care Act, and that's where, again, CHWs were illuminated and emphasized and valued and just bubbled up to the top when we were trying to get everybody enrolled in health insurance back then. 2014, Illinois, we signed our first CHW legislation, which adopted a standard definition, that APHA definition. It created a CHW advisory board, and which created recommendations around the workforce that dealt with advancement of CHW. So it dealt with certification and reimbursement, financing, training and education, core competencies, and workforce development. And again, I saw Renuncia, I'm gonna keep highlighting her, and others were definitely involved in that board under the Governor Quinn's administration. 2015 recommendations were created by that board regarding, those particular areas. In 2015, the Chicago CHW local network, we changed our name. In 2018, we partnered with the Department of Public Health on an 1815 grant, where we worked with the Department of Public Health to advance, CHWs in chronic diseases around heart health, diabetes, oral health. So we were fortunate to be a part of that. We hit the road in 2019 because we're under a new administration with Pritzker, and we really wanted to find out if those recommendations from 2013 were still relevant today. The recommendations didn't get an opportunity to move forward as we thought they could because, the right players just wasn't in place to help us move this forward. So we wanted to just find out across the state of Illinois if those recommendations around the core competencies and skills, workforce development, financing, reimbursement, certification, and training, were they still relevant today before we start moving forward this agenda on how we're going to continue to advance CHWs here in Illinois. And we found out that they were still relevant. We were missing a few things around trauma-informed care, around substance use. At that particular time, the opioid overdoses were rising, and they're still rising, unfortunately. And mental health came up a lot in that conversation. So the recommendations were still relevant today. We just needed to ensure that we had some discussion and some more information around those key areas there. So 2020, ILCHWA was a 501c3. And then in 2021, we had the legislation with the Legislative Black Caucus, the strong advocates and supporters, Senator Maddie Hunter, as well as Representative Lilly, really supported and added CHWs in their health bill. So while that bill is like over 300 pages, we were fortunate to get a piece of that bill that really discussed CHW reimbursement through Medicaid, first time ever in the state of Illinois to make it so official. We also will be establishing another board, but this is going to be a certification board to really try to lay out the certification of community health workers in Illinois. And all of this is in collaboration with the Department of Public Health, which ILCHWA has been identified as a co-chair of this board. And I think I just want to highlight that piece right there because Marie asked me to talk about policy things, right? And so I hope I'm not going too fast. I'm definitely going to stick around for questions. But this last piece of legislation was so important for our workforce, and it brought up some concerns. I'm going to drop in a report that we did. We hosted roundtable discussions across the state of Illinois, and we talked about that bill, and we gathered people's input around recommendations on how to implement this bill. And that report is going to serve as a foundation to the CHW Certification Review Board, which will have its first meeting September the 27th. It's going to be virtual. People have been identified as members of that board, but that doesn't mean that if you didn't get the letter, you will not be engaged, because that is the role of ILCHWA, to ensure that all the voices, all people interested in the CHW workforce activities have an opportunity to provide input. So we will definitely be sharing out that information. So don't fret. We have heard a lot of concerns around professionalizing the workforce, harming existing efforts that already train CHWs, reimbursement structures, and things of that sort. So we are on a mission to not hurt or harm current activities, but really understand what's going to work best for us here in Illinois. We're not interested in not having a certification opportunity be made available to those that want to be certified, but we're very much interested in maintaining the essence of the workforce and not making certification mandatory for people that just don't want to access the certification process. So we're definitely looking to ensure that those things take place. We are taking into consideration people that, trust me, we have heard it all, but if you feel like you have some additional information or that you want to share with me so that we can ensure that those things get incorporated as we move forward through this certification process, I will definitely drop my contact information in the chat. You all are welcome. I see Addie on here, who is with Suhi, but they co-chair a workforce development committee with us. And so we have that. We have a certification financing and reimbursement committee meeting. These meetings happen monthly, so you all are welcome to attend. And that's where we talk a lot about the CHW workforce and develop a policy and advocacy agenda during those meetings. So again, these are some of our focused activities, those work groups that I just mentioned. I love Ashley's leadership with CHW section. She's so creative. She's so just on it. The CHW awareness campaign that happened through the CHW section, like we're gonna mimic that for us here in Illinois, because there are still people that don't know who CHWs are. There are still employers that love the idea, but don't know how to incorporate them into their workforce. We have CHWs right now that are struggling in the roles that they're in and don't know how to advocate for themselves. So we're really pushing for this raising awareness around CHWs. We're also focusing in on the CHW mapping piece, because if you go and look at our state numbers that like the Bureau of Labor and Statistics that report, remember I talked about that standard occupational code. So those numbers go to our employment system, and they calculate how many people we have working under certain titles. And in the state of Illinois, that number is so underrepresented. The last time I checked those numbers, it stated like 2,000, it was like 2,300 community health workers in the state of Illinois. I know Suhi has trained 23 CHWs alone. So I know that number is definitely underrepresented. So we are interested in finding funds to support a statewide CHW mapping project. And then we have our member services, things that cater directly to our membership. And those are the activities of the CHW Association. So this is my contact information. This is where you can find us on, find out more information about our membership. Membership is, pretty cheap it's reasonable. Let me say that, because I don't want to, some people feel like if it's cheap, then it ain't valued, right? But we did it that way across the state. We definitely checked to see what's a nice membership price for CHWs. And I think the membership is going to be $25. And so we'll definitely, and then we have different categories for allies, for organizations that employ CHWs, et cetera, et cetera. So you can go to our website and click on that membership tab, and you can find out more information about our membership.